Good morning. I am Dr. Amal Kumar Banerjee. I am the cardiologist. I think that patients nowadays with the chest pain, which are very common to the either the hospital emergency department or at the clinics of any physician, but sometimes we find that serious patient having the uh, patients who require immediate cardiac intervention, they are being missed. So I try to emphasize upon the audience that how first to detect those patients who require immediate attention. First, for clinical presentation, we should require the take a history of the chest pain, particularly the nature of the chest pain, site of the chest pain, whether patient is having cardiovascular risk or other things. And then for physical examination, we should have the blood pressure recording, pulse, auscultation of the heart, whether there is any murmur, features of heart failure, all these things. Then we should go for the investigation images. The first line investigation is ECG. If the initial ECG or the first ECG is normal, then we should not think that this patient is not having any cardiac problem. We should go for the serial ECG at least 20 to half an hour and observe the patient since the patient is having the pain. By that time, looking at the ECG, we should look whether the ECG is normal or having some other problem. There are some ECG findings, apparently the patient not having the pain, they might have some important features in the ECG which might point that the patient having the serious cardiac problem. Then for the risk stratification, we go for, as I mentioned earlier, that they require detailed history, physical examination on all these things, and depending on that, we can go for the clinical classification or categorization of patients for the low risk, intermediate, or the high risk patient. Now, another important issue is a biomarker, assessment of biomarkers. Nowadays, we advocate high sensitive troponin T or I. From this assessment of the troponin, if it is below certain level of troponin TI, then we can brand the patient as the low risk patient. But when the patient's level of this biomarker or troponin is between the low level and the 99th percentile, then it is very important to go for another test after say 3 to 4 hours, and then if there is an increase at least more than 3, then we think the patient is having the high risk group, and accordingly we go for the admit the patient and go for the management issue. The patient who are having the chest pain, high risk or intermediate risk group, if the patient have the same history previously, then we go for first the CT angiography. If the lesion is less than 50%, then we discharge the patient with medical therapies. More than 50, we go for some further tests, and by invasive catheterization, we go for the patients and FFR also. Whether the FFR is less than 8, then we go for the patients for PCI. These are in short the management and assessment of the patients coming to us with the chest pain. Thank you.